السلام عليكم دكتور فتحية.
يا هلا وسهلا دكتور جمعة، حياك الله وصبحك الله بالخير.
الله.
Welcome to our colleague as well, and good morning to everyone from Dubai Conventional Center, where we are hosting the EDEC 2026.
What's up? A great pleasure to be here. It is the 16th Emirates Diabetes Endocrine Society Congress meeting, and we have in this meeting more than 4,000 attendees from different parts of the world. And I was amazed with the submission of the abstracts for the scientific meeting, and they received over 300 abstracts from different parts of the world. And this is great achievements. The faculty, we received international faculties from USA, from Canada, from Europe, Australia, and different parts of the world, including the region. And it's a great representation of and wealth of knowledge we're learning from.
And we have around people from 35 countries as well, Juma.
Amazing, amazing. Dr. Fatheya, you are the president of the society for a number of years now, after taking over from Dr. Madani. Could you tell us something about the history of the society?
See, Professor Juma, the society was established in 1995 as Emirates Diabetes Society under the Emirates Medical Association, which we call our mother association. The EMA have between 44 to 46 very active society. One of them, which is the most active, which is also dear to my heart and your heart as well, and many of the colleagues, and also our EDS board, is the Emirates Diabetes Endocrine Society. Over the years, we changed the name from Emirates Diabetes Society to Emirates Diabetes and Endocrine.
Why there's a change?
Because we thought we have, a broad community of diabetes and endocrinology, and we thought it's not only diabetes is a disease or a problem that touch our communities from UAE national and also from the expat, but in fact even the endocrine disease, it was like a forgotten part, and we thought it's nice to bring join both of the disease perspective under one umbrella. And I think it did work, Professor Juma, don't you think so?
Very much so. It is much more inclusive.
Yes.
And the problem for the public, or rather when you say about diabetes, you think about type 1, type 2 diabetes, gestational diabetes, or any other type of diabetes. But even the old days we used to deal with endocrine, we didn't include it, but to shed more light on it, and to shed more light on the importance on the endocrinology field, it was the right decision to include it in the title of the society.
I absolutely agree with you on this, and I think it had added a lot of flavor to our also educational platform, as well as our conference as well.
Okay, now looking at the activity of the society, what is one of the most active society in the UAE scientifically, we have the annual meeting, the Congress meeting. Along with that, we have a number of meetings across the whole year, and it is within the whole UAE, the whole seven Emirates engaged into it. Plus, we are reaching out to our neighbors, the region, and the area in total. So that's serving larger population and reaching out to the professional individuals dealing with diabetes and endocrine, whether they are physicians, nurses, paramedics, allied health services, to improve the health care for the patient and the nation.
Professor Juma,
could you touch more on the activities related to the society? What do you do across the year?
I think, as you just said it correctly, that we started with initially doing only the conference, the annual conference, and we thought that's not enough. Because we are thrive for education, and we want to be up to date to match the international standard, and I think our community deserve to have that knowledge, that we educate ourselves as a healthcare provider. As you just said, it's an MDT of healthcare providers, not just the physician, it's the educators, the clinical nutritionists, the psychologists, the podiatrists. So you need, and also the volunteer who can help us, the patient community themselves, they can also support us on this, the patient voice, in order to expand and give, or translate that impact of these disease on our community. So I think the main fundamental thing that we've done is the EDEC, which had also progressed over the years. As you know, we started in 2009, and now we are on our 16th edition, and day by day it is expanded. We started with 600 delegates. We are talking about addition of one extra zero, so it's now 6,000 people who attend, or colleagues who attend, not just from UAE, from the GCC as well as from the MENA region, and some of them even outside the MENA region as well. So there are multiple activities that took place over the years.
Last year the meeting, the Congress meeting, was in collaboration with the International Endocrine Society. And years before it was with the IDF as well.
Absolutely. We hosted 2 International Diabetes Federation conference in the past. And also we hosted the International Society of Endocrinology just 2 years ago. And that showed that really in this country we have an infrastructure to host mega conferences. This is not new for a country like United Arab Emirates under the leadership of UAE. So we are very proud, and we are an ambassador for our countries also, to the nation abroad.
I remember with the huge meeting we had with the IDF, the attendees exceeded 18,000. Before the meeting, we had a meeting with different parties, and including municipalities, the police, and so on. And their aim is to help us to conduct successful meeting in the country of high caliber, high standard, and making sure that our guests coming in, they're going to receive the best treatment. They're going to be in a place that they feel they enjoy the meeting, they enjoy the gathering, and that's the aim.
I think it's very important to have multi-stakeholder to support us with our initiative. And over the years, this is what we've have seen from the leadership, from important department that you mentioned, that they've been with us in this process, and they are always there, to give hand and support us to build up an excellent platform, for education. And I think we did achieve it, Professor Juma. Yeah. Don't you think so?
Very much.
Yes.
And even with the going to the level of the public and so on, the society has reached there. There's the 3-kilometer run used to be done on a regular basis. Tell us about the marathon, the exercise.
We run lots of even community activities, not just educational activity, and we partner with many good partners over the years, to celebrate the World Diabetes Days by doing a huge campaign where attended by our healthcare provider as well as our public. And this is like part of our duty as a healthcare provider, to support our community to become healthy and actively engage and involve. As you know, if we talk about diabetes or obesity, we have a high prevalence, but today we heard also a very interesting data from our colleague that there are lots of initiative to control and compact these diseases which put burden on our healthcare sector. Apart from the conference that we are doing, Dr. Juma, please let me know what other activities that you've been heavily involved in this as a vice president as well.
You're keeping us busy throughout the year.
Tell us about it.
So many activities. We have the UAE Endocrine Club. We conducted a club meeting across the whole country, and there's the Young Forum.
The Young Leader Forum, yes.
Leader Forums, and it is doing very well. We got the young professional in the field of endocrinology, or interested in the field of endocrinology, or resident or fellows. They are engaged and the education activity platforms, either attending meeting in person or virtual meeting. Along with that, there are other meetings as well. We had the cardiometabolic guidelines released. We had with multiple workshops across the whole country, regular basis. We had the release of the retinopathy guidelines and the release of the nephropathy guidelines. With that, there's lots of educational material being delivered, almost, I would not say weekly basis, but in every month there's one or two activity here and there across the whole country to reinforce the message of better health, better diabetes control, better metabolic control for so many diseases.
Because it's important to give the education and the tool to our healthcare provider and enhance their scale in order to deliver the best to our community. So if I just summarize it, Professor Juma, from the terms of the activity that the society is doing, we do something called the EDS Connect. And under the EDS Connect, we do multiple activities. Part of it is the implementation, whatever guideline we produce. Because as you just mentioned, we had just, published cardiometabolic guideline, renometabolic guideline. We published post-bariatric guideline, retinopathy, as well as the updated type 2 diabetes guideline. And we strongly believe as EDS board, with many, many colleagues who are key opinion leaders in this country in the diabetes and endocrine community, that we need to implement whatever we advocate for. So it's very important not just to produce without implementing it by providing those workshop and webinar.
What about the journal? That society has a journal to it or not?
Oh, that's an exciting news, Professor Juma. And yourself being in a university, and we have lots of good colleagues also from other universities in the North Emirate, like Sharjah University. You've been, both of you, supportive. We just, took over the Dubai Diabetes Endocrine Journal under the umbrella of the EDS, and that will also add to whatever we are doing in terms of encouraging research, encouraging people to submit, and also we are raising the bar not just in terms of educational activities, but also raising the bar in terms of research, because you see most of the research that we deal with, it is done on other population, maybe not ours, maybe they're genetic different than us. So it's very important we have to generate something from our own population.
And I remember as well the message being sent abroad about the society and activities. Meeting in South Korea with a booth for the society, a meeting with in USA, number of meetings in USA with a booth for the university, for the society, and other. If you could remind me about other activity you've done outside UAE.
And that's very important. As I told you, we expanded over the years. So that networking with international association was very important for us, because that also will enrich our knowledge, our expertise, and our networking. So we already have a good affiliation with the American Diabetes Association, where we run with them last year technology programs. We also have an affiliation with the IDF, International Diabetes Federation, also with the International Society of Endocrinology. We did also have our knowledge partner, which is the Endocrine Society. And we have also with the DAS group, which is an Asian group, at the Pakistani Society as well. So there's diversity from international, regional, and local, association. And not only outside. I should not forget even the inter-society, work together. For example, we work very closely with the Cardiology Society. We publish guidelines together. We do common activities with them. Also, we have also connection with Ophthalmology Society. Soon we're going to have with the Internal Medicine Society. And I think this is very important about integration, about collaboration at all the level, because now in our field, it's not just, you depend on a single-handed. That multidisciplinary approach is not just the way we manage, but even the way we deal with each other as a colleague as well.
Very much. And looking at the needs as well, I remember Years ago, you were mentioning that our colleague, they're traveling to USA just to practice and to learn how to do ultrasound thyroid and how to do the FNAs for the thyroid. And here we are, over the last few years, you are organizing wonderful workshops before the Congress just to teach the techniques.
Don't you think this was much needed so that provide the hustle of traveling and the costs and expenses to bring it at a hand when you have a great expert speakers with you who can support you on hand-on workshop and courses? Over the years we've done technology workshop, we've done a couple of times ultrasound workshop, and in this conference, just prior to this conference, we have a successful ultrasound course which was hand-on. Because as endocrinologists always we say, it's the ultrasound is an extension of our hand, so that we better manage our thyroid patient as well.
Thank you so much, and thank you for aligning up with international figures, the gurus in their field, whether it is bone health, thyroid, or speaking about type 1 diabetes, type 2 diabetes, or others, where from all around the world, we look for the best practice and we try to bring it over here.
Absolutely, because this is what we need to do. We have, a healthy community, and it's very important to have a healthy community. We need to educate ourselves and educate them as well. Dr. Juma, you know that we had just launched the type 2 diabetes guideline, which we updated. It was initially, launched in 2020, I think, and you are part of the authorship as well with many other key opinion colleagues. So tell us about the new launch of the guideline that we just announced yesterday.
To produce a national guideline for management of a common problem like type 2 diabetes is very important. You don't want diversity in practice, whether from one place to another. You would like your colleagues to practice on the same theme with the latest recommendation and guidelines worldwide. And we looked at different resources like the American Diabetes Association guidelines, the Endocrine Society guidelines, the NICE guideline in the UK, the European guidelines, the Australian guidelines, and other guidelines as well within the region and beyond. And having a team to look at the guidelines in general, and we divide them into groups. Mm-hmm. There's somebody going to look at the epidemiology part of the type 2 diabetes, a group going to look at the etiology of type 2 diabetes and the impact of obesity on type 2 diabetes, and looking at measurement, pharmacological treatment of type 2 diabetes, the use of technology in type 2 diabetes, and the lifestyle measures in type 2 diabetes, whether it is exercise, nutritional, smoking, or other field of it. So, and over how many, 5-6 months we had?
Almost 10 months we've been doing this, yeah.
Yeah, but
and I think we just, as you said, we just took the, we were guided by the international guideline, but we tried to tailor it to suit our community, yeah, based on the prevalence data that we have seen in terms of diabetes, pre-diabetes, and obesity. Because maybe what suits other society might not suit us. And as you know, that we had lowered the age of screening for diabetes to a young age, which is less than 35, because we've seen a high prevalence of diabetes and pre-diabetes, and specifically in this age group. And it's as a mandate for us as a healthcare provider that we need to look after this group, because today they are in their 20s and 30s, and tomorrow they will be in their 40s and 50s.
Absolutely.
And we know that there is link between diabetes when on a long duration, if it is a long duration diabetes, and with the risk of the complication. So the earlier to control and the earlier to detect, it is it's better to protect our society. And
I remember when we put the recommendation last time in the edition of 2020, we were saying, what about screening age for type 2 diabetes? Because the ADA, they said above the age of 40. We said no. according to our local data here, will do it at the age of 35.
And I think it worked.
And now it is being even revised by the ADA,
Yes.
and it is 35. And for in this version of the guidelines, we brought it down to 30 years.
Yes.
And that's not a random figure. This is figures based on consensus, surveys, publication, and looking at the local data. And we should look at what is the threshold we should look at to provide the best screening stage for our patient.
Absolutely. Professor Juma, one more thing. What you want to tell our colleague who's listening to us now on the live stream? At your back already we have the Emirates Diabetes Endocrine Society booth is there. So what you would like to encourage them to do at this point?
Dr. Fatheya, this is well, we always say that, but it's very important. First, be a member of the society. The society there for you. It's the society for all of us. It is not for certain individuals. We all play major role in the management of and treatment and follow-up of our patients, and would like always to provide the best knowledge, best facilities, investigation, medication, and so on. So being part of the society, being part of this community will serve us all good.
Yeah, being bigger will be more stronger.
Definitely.
And if we are one hand, that will also give us a platform to be more, to give more as well.
And we try to do always that every activity we do, we put it either on YouTube free of charge, and we do education activity that virtual and it is free of charge. And please support us, be with us, be part of us as well.
And those attending the conference, they can always walk to the booth today and tomorrow, and they can register. And if they did not have the chance to do this, they can always log on to our website, which is also connected to the Emirates Medical Association website, where they can have the chance to do their registration and become an active member. And not only this, Professor Juma, I always say that the EDS is for everyone. It's not just the board, it's not just few of us who contribute, or it is for everyone. We have many good colleagues who've been contributing over the years by providing us with strategic planning, by giving us ideas about educational programs, by leading some of the program. So from this platform, we want to encourage every healthcare provider. If you have any ideas, if you have any creativity, you want to be part of us, part of the EDEC, part of many other activities we do throughout the years, please do not hesitate to just write to us and come forward, come with the ideas. And our role as yourself as a vice president of the society with Dr. Khalid al-Dahmani and Dr. Asma Jassim and Dr. Raya al-Mazrou'i, together we encourage all our colleagues to come forward and come with these with their suggestion and with their proposal, and we will study these proposals and we find them they are suitable for our platform. Definitely we will support you, and we will empower people also to take ahead.
Definitely.
And how about the young generation, Dr. Juma?
Oh,
I know you are in university, and you are surrounded by many good medical students, fellows, and
the young people are the futures, and we strongly encourage them and the learning. It is a lifelong process. It never ends by sitting exam or passing the exam. It's a lifelong commitment, especially in medicine, and with dynamic changes in knowledge, and it's very important to keep up and updated with most of the
So would you encourage them to be volunteer, to submit the abstract to the conference, to come and present in
I
oral?
was glad today to see a good number of students, whether from UAE University, Sharjah University, MBR universities, or other universities submitting, discussing their research. And that's a great step forward. When you see a promising young students coming, or residents or fellows, and they present, and they are keen, enthusiastic, and happy to present and share what they've learned. This is really rewarding.
Yeah, I think it's our role to mentorship them and, to identify those who's going to succeed, to do the succession plan and, to lead, this type of, activities and platform in the future.
And each one of them has a potential to be great in something.
Yes.
Either in their delivery of care or education or admin or institutionals. Each one have great growth.
So I think they need to
And
seek
it's-
the
and
opportunities.
it's very important to invest in them. See what they like to do, what they're good at, and take it from there.
Right. And adding to this, because we are talking about the young generation, how about the technology? You know that this year our opening video was focusing on technology and AI.
Yes.
So what is your, view on this?
We should be partner with advancing technology. We should be, I think it is so fast developing that we can't hide from it. And the moment that you are delayed in engaging to be with the advancement in this field, you'll be behind, and you'll be behind a lot. So in every single field, with the artificial intelligence or other technologies moving in, and moving in fast, I feel that the way we're learning, the way we practice, within 10 years from now is going to change markedly. But for the better. And we should think always about artificial intelligence and other as a partner to improve the current situation for the better and for the better of everybody.
And it's very important, Professor Juma, providing these tools, especially to our patients who have diabetes, that we need to provide them with a platform of education and learning, because it's difficult just to give a tool without, further education and supervision for both, actually, for the healthcare provider, for people living with diabetes and their caregivers as well.
Yeah. Speaking about technology now, we could say the job of a pharmacist to dispense and educate the patient about medication, but a robot could do that. The physician could write the prescription, right? The robotic in the pharmacy could package the medication, and it could be sent home to the patients. But the human touch, the educational part in it is missing. So we support advancing technology, better delivery of medication to the patients, but with the proper education that the patient needs.
Absolutely. Professor Juma, I take this opportunity also, and I'm sure on behalf of the EDS, we need to thank many of good colleagues who supported us through this journey from the time we established the society till date. They are maybe working at the backgrounds, and definitely we need to identify all those colleagues who led lots of projects into the society and supported us in our vision and taking our society and even our conference to a high level of engagement and also of visibility as well.
Very much. It is collaborative work. The more we share, the more we have. And if I look to my life, there are people in my life that help me a lot. The same with everybody. So having supportive individuals who leave remarks and marks, and it reflects so strongly in improving the person, improving the development and the advancement of the professional person forward. That's a must. And we truly support young people. And we highly appreciate the senior one who gave us the hand, the support, the wisdom, how to advance, how to be better.
And I think just to add to this, I don't, and this is an advice for anyone have, ambitious and they think it is challenging. I can say it is not challenging. every opportunities come, towards you. Try to take the opportunity. Believe in yourself. Believe that you can do it. Believe that you can excel. And this is exactly, if we go back to the, the time that the EDEC had started with, a wisdom and also with a vision of Dr. Abdulrazak Al-Madani, the founder, and then
And the father.
And the father of diabetes as well, and endocrine, and then, the opportunity that you've given yourself, myself, to Dr. Ayad and many other colleagues with us on the board, that, from, no conference, today we have our 16th edition. So, Professor Juma, I totally enjoyed, this dialogue with you. And I know we have a busy day schedule that we need to go to. Thank you for your support.
Thank you for every minute you spare for the meeting, for the society. And thank you for the great effort you've been putting in the society. And you really leave a special touch with our guests. Over the year, I felt it that you deal with every single guest as a special person.
Thank you very much.